Welcome, Jolisa.
Michael, you're so much taller. I need to move this down. All right. All right. Good morning, everyone. If we have not had the pleasure of meeting, my name is Jolisa Kramer, and I'm with the Healthcare District of Palm Beach County. I've served on the board of directors of Leadership Business Council for over 2 years now, and it has been my honor and pleasure to get to not only listen to, but even introduce some of the most amazing speakers and business leaders in the area and all over the country, I would say. So today, this morning, I'm extra excited, and it's a very special morning for me because I get to introduce to you my leader and the CEO of the Healthcare District. Before she gets up here and tells you a little bit more about who we are, I'm going to tell you a little bit about her. So Darcy J Davis is the Chief Executive Officer of the Healthcare District of Palm Beach County and its subsidiary operations. She joined the Healthcare District in July of 2011 and has served in several roles of increasing responsibility, including Chief Financial Officer and Chief Operating Officer, prior to her promotion to that top executive role. Ms. Davis was named CEO by the Healthcare District Board of Commissioners in February of 2016. She serves on America's Essential Hospital Strategic Planning Committee and the United Way of Palm Beach County's Hunger Relief Advisory Council. She also served as a proviso member of the county's Sober Home Task Force, and in 2018, Governor Rick Scott appointed her to the Palm Beach State College District Board of Trustees, where she served for 3 years. Annually, for the past 5 years, the South Florida Business Journal has recognized her as a power leader in healthcare, and in 2017 as one of South Florida's most influential executives. In 2021 and 2019, she was honored by the Palm Beach County Medical Society as Hero in Medicine. Ms. Davis has earned her BBA in accounting from Mercer University and her MSM in healthcare administration from Troy State University. And so without further ado, I would like to introduce to you my leader and CEO of the Healthcare District of Palm Beach County, Ms. Darcy Davis.
Thank you. Wow. This is the first time I've seen faces without masks in quite a while. It's very refreshing, and especially in this beautiful location here at the Bend. So thank you for having me. And I'm going to tell you about the best kept secret in Palm Beach County, the Healthcare District. So we are an independent special taxing district, which means our board has the authority to levy millage, and they did so, in fact, just last night. We had the first of our 2 TRIM hearings, our truth and millage hearings. Our board is not elected, they are appointed. I'll tell you a little bit more about them when I show you their faces in a second. The Health Care Act was originally put in place in 1988, revised most recently in 2003. But I like to talk a little bit about the balance that we walk, because we are a healthcare organization. That is our business, that is our mission and our purpose, that's our competition. We're competing with hospitals for clinical staff. But we're also a government, so we have certain restrictions on how we can invest money and certain rules in terms of how we purchase things. I talked to you a little bit about those board members. They are Republican and they are Democrat, and I'll show you those faces in a minute. We have an obligation to the patient, that's our business, but we also have an obligation to you as taxpayers. So again, the balance, what's right for the patient, what's right for the taxpayer. And then we also serve as a provider, so we provide care. I have physicians and nurses that are treating patients. And we're also a payer. We fund other organizations to do certain things that are support our business or are complementary to our business. And then we're a community leader in healthcare. We are Switzerland of Palm Beach County when it comes to healthcare. We are partners with a number of other, nonprofit agencies, but all the hospitals in the county, other healthcare providers. Our mission, in a nutshell, is to be the healthcare safety net for Palm Beach County. So here's the faces of my bosses. So these are our Healthcare District Board of Commissioners. There are 3 that are appointed by the governor. That's the Republican part I was mentioning. And there are 3 that are appointed by the County Commission. County Commission has a couple restrictions on who they can appoint. And so one of them must be an elected official. Corey Nearing has been serving in that seat. One of them must live west of 20 Mile Bend to help serve the Glades community. That's Tammy Jackson Moore. And then they have an at-large position, Shane O'Bannon. And then that's 6. The 7th member of our board is Dr. Alonzo, the director, whoever fills the seat of the health department director. That is our board. This is our leadership team, our senior leadership team, in case you've recognized any of those faces. I notice men always say, wait, there's not very many of us in there, but we do have a lot of very strong, powerful, smart women, and we also have a few very strong, powerful, smart men as well. So I don't read this. This is that legislation. I don't read this to you. All I want you to take away from this is that we have a very flexible enabling legislation that allows us to do things like respond to COVID by chance. It allows us to ramp up and step in when there are gaps in the community in terms of health needs. So we've most recently stepped in to help respond to the opioid crisis. We're expanding our footprint in the behavioral health space. So we ramp up and we ramp down, and we're fortunate to have the enabling legislation that allows us to do that. So a little bit more about what we do. So the provider hat and the payer hat. First, as a provider, we own and operate a rural hospital out in Belglade. It's known as Lakeside Medical Center. It is actually a real functioning hospital. It is a 70-bed teaching hospital. We have a family practice residency out there, has been there since 2011. We have a very, very busy ER. We do surgeries, general surgeries. We have an ICU. And we've been using that hospital quite often in our ICU with COVID. We've seen a lot of the community come through our doors throughout the COVID crisis. And we also deliver babies out there. A lot of people don't realize that, but it is a rural acute care hospital. We have a long-term care facility known as the Healy Center. It's just in the shadows of the VA Center in Riviera Beach. We have 120 beds there, a very atypical patient profile, because our purpose is to be the safety net. So we're taking patients that would otherwise not be taken by another nursing home. They don't typically have a funding source. Many of them are men. Many of them have had traumatic brain injuries or long-term illness, because as you know, men don't typically qualify for Medicaid. So that's typically our profile. I think last I checked, our average age was 53, so younger men. And in fact, I'll just stop here for a second. I had no idea how many people fall off of bar stools and have traumatic brain injuries or are hit on bicycles. It's shocking. But we have a lot of those. We have a lot of those patients. School health program. So a lot of people don't realize this, but we actually employ over 180 school nurses that are in nearly 170 schools across the county. Many people think that's the school district. Those are our employees. We work very well with the school district, and we also work with the health department. Usually someone at the end usually says, what's the difference between you two? So I'll wait for that question. But we actually have a very large, robust school health program and have done a lot in response to COVID, which you'll see a little more on. We also, I like to say, our federally qualified health centers are the front door to the healthcare district. So we have clinics. These are clinics that see people regardless of their ability to pay. They're federally qualified because we get funding from the federal government to operate them. We have 9 locations. We now have 3 mobile clinics. And this says we had 3 vaccination sites, but we actually dismantled those, and we're doing all of this through the mobile clinics now. But we do an integrated care model. So we provide adults and children medical, dental, behavioral health care. We also have women's health and pharmacy for those. So we actually have a program that allows our patients to get free or no cost, free or low cost pharmacy drugs. Our most recent addition is the substance use program. So the medication-assisted treatment, we actually have a clinic where we help folks with an outpatient medication-assisted treatment program. We have a partnership with JFK that is still in its infancy and continuing to grow, but that's a centralized ER for overdose victims. The concept is that the ambulance will bypass the closest ER with an overdose victim and take them to JFK North, where they will stabilize them in the specialized ER. In that ER, we have specially trained psychiatrists, social workers, peer counselors to help embrace that individual and help stop that cycle of overdose, to help stop that treat them and street them mentality, which is often in an emergency room. They want to just stabilize and get them discharged. Our goal is to help get them into the right program out of the ER. Before COVID, our mobile units were doing healthcare to the homeless. We're trying to get back into that space, but right now we're very focused on vaccination efforts. But at the end of the day, with our clinics, the piece that I like to make sure people understand is that we have a no patient left behind mentality, meaning if we can't take care of them in our clinic, if their needs are beyond what we can provide, so if they have a specialist service, cardiologist, we pay for that. If their financial needs are such that they need an advanced level, that's part of the benefits that the healthcare district will cover. So now I'm shifting gears as a payer. So we do all those previous things, and we employ the staff that actually does all those services. As a payer, we own and operate the Trauma Hawk helicopters. Hopefully none of you have ever needed our services. But if you have, we have an amazing safety record. And we contract with Palm Beach County Fire Rescue for the medical coverage in the back. So it is literally an air ambulance. They're providing the medical service. We have the pilots, the mechanics, the hangar, the license, the air ambulance license. Florida Department of Health. So as I mentioned, we are 2 separate entities. Dr. Alonso sits on our board, but we have a very a very tight, incestuous, perhaps, relationship with the health department. We provide funding to them. We fund about 18 to 20% of their annual budget. So where they have shortfalls in maternity care or preventive services, the healthcare district helps provide funding for them. Annually, we do a sponsored program. So we do an annual grant process to nonprofits who have similar missions or similar missions to ours, and we will provide, I think, about 19 to 20 different agencies. Up to about $2 million is our total budget, so about $40,000, $50,000 or so to some of these agencies. And then as a payer, actually I talk a little bit about Trauma Hawk here, but as a payer we also are the trauma agency for Palm Beach County. So we were given the obligation by the county to oversee the quality of trauma, pre-hospital, in-hospital, and post-hospital care for all trauma cases in Palm Beach County. So we don't actually operate, St. Mary's or Delray, who are the trauma centers, but we help subsidize them for those uninsured patients, and then we oversee the quality of care. So that's where the trauma system and then aeromedical as part of that pre-hospital all start to work together. All right, so this is a footprint. I've given you all of this about what we do. We have about 1,400 employees doing all of these things I just mentioned. And I guess our mantra is we're taking care of those who might otherwise fall through the cracks. These dots, I'm sure many of you can't see them, but they represent just geographically where we are. Most of the yellow ones are schools, but you can see along the East Coast we have representation with our clinics, and then we have a big footprint out in Belglade. with our hospital, our school health, our clinics, and so on. So there you have it. And in it's really fast up here, but I can tell you I felt every minute, every moment, and I'm still feeling it. It was a lot, nonstop, and we mobilized very quickly. I have to say I give credit a lot to our Chief Medical Officer, Dr. Belma Andrick, who is on the cutting edge, and I can tell you that we started testing before everybody else was testing. We were doing testing, and within, I think, 3 days, we were meeting with the National Guard, the county, the health department, and we were telling them how we were going to set up the drive-through. And I think it was, but they got over that, and then all of a sudden it worked really well. But it was a lot. And I don't know if any of you had the pleasure of going through the drive-through sites. We ended up with 3 sites, testing, and then we set up those mass vaccination sites. And I like to say we mobilized our healthcare army, and they absolutely stepped up and responded. So, all right, let me show you what you're looking at. So while we were doing testing, data was everything, because in order for us to know how to staff, where to be, we had to know what we were doing. So this actually represents just, the test. This is the testing phase. You may remember the 2 spikes. Top one are the tests performed, the bottom one are the positivity rates. The reason it drops off is because once testing became more widely available, we get out. And as I show you the wheel of phases in terms of how we respond, so we were there until you can see it starts to drop off in May when testing became more widely available. This is the school district. So we are still screening, testing, and advising the school district on how they should respond with protocols regarding the students in the schools. So this is just this year. We have stats for last year, but just this year, since August 10th, our school nurses have performed 16,705 screenings. They've recommended 2,105 of those. And if you look, 32%, let's see, of the screenings, 32% of those were recommended for screening, which means 68% of the children got to stay in school. So they may have shown, instead of just immediately sending them home, because our nurses were trained in how to identify who needs a test, who doesn't, we kept a lot more kids in school than we might otherwise have done. In terms of screenings, what were they seeing? A lot of headaches in terms of the symptoms, sore throat, runny nose, and again, those were the things that ended up also being the symptoms that led to positive tests. Let's see. This is just more data within the school. One of the things we know, elementary school, kids come more often to the nurse, but if you see the positive results, our high schools, so Boynton Beach, Palm Beach Gardens, Royal Palm Beach, those are some of the higher numbers. But here on the bottom right, the good news is our positivity rate is going down a little bit, now down to 5.2% as of the 19th. All right, shifting from testing, let's talk about vaccination. This is the phases. So when there were very limited supplies of vaccine, we had very strict rules about who could get the vaccine. We were in the mass vaccination site. Even before we set up those sites, our mobile units were at John Prince Park. We were at various places trying to get folks to come to us. But only those over 65, then it was 55, but we had very strict rules. Then as it became more widely available, we started stepping back from some of the mass sites because we needed to get back to business. We still have clinics to run, and we have clinics where we can do the vaccinations. And so that was phase 2. And then in phase 3, there is sufficient vaccine everywhere, and we're now just using our mobile units and going out into the community. So, I already talked a little bit about this. These were the 3 sites. We set up the South Florida Fairgrounds, South County Civic Center, Burns Road. I think the technology that we used was phenomenal. If you had the pleasure, I hope it was a very short experience for you. Most people said that it actually took longer to sit there and wait to see if they had a reaction than it did to get through the process, because we did all the pre-registration online in advance, all the consent, and most people just, came right through there. So here's those numbers. Again, data was everything for us. We've given 219,000 vaccines. You can see there's a pretty even split up there between the Moderna vaccine and the Pfizer vaccine. Janssen is a lot less popular for a lot of different reasons. 107,000 of those vaccinations were given at the fairgrounds, and more women got the vaccine, 55%. And if you look at that age range, it makes a lot of sense because that's where we started. So we started at the 65 and over, 55, and you guys remember how that dropped very quickly from guidance. We also were tracking geolocation. Where is everybody coming from? So we would know where are those hot spots that we need to get to, and with the mobile unit or with marketing outreach, where do we need to go? And then the age distribution. I find this fascinating. For those who can't see this scale in the back, that number, the highest, good job, 75-year-olds, because they hit the highest mark there. But I'm also fascinated by the fact that we had 104-year-olds that we vaccinated. So I just find that very interesting. So after we stepped away from the mass strategy, our strategy has been those mobile vaccination outreach. And so we've been working very closely with the school district, trying to get that 12 and older population in the schools. We have been in entertainment venues. We have worked with employers to go when they have a number of people that they say are willing to get the vaccine. And then we've targeted communities where we know that they have not had a very high vaccination rate. We've gone out there and tried to entice them to get vaccinated. You don't need to see this. All I want you to see is this is our mobile unit schedule. I don't want you to read it. Just know that every color is a different mobile unit and a different location where they're going to be every day of the week. They are very, very busy. Unfortunately, there you go. Since we've been doing the mobile rollout June 1st, we've only done 5,000. So gone are those days of mass vaccinations where we were doing about 100 every 15 minutes. We are now happy when we get 70 a day or 40 a day. But you know what? Small numbers add up. So again, similar data, but on the mobile unit, we are giving a little bit more the Johnson & Johnson than other locations. And that's mainly farm workers who say, just give it to me, I don't care, give me something, and then move on. So there is life beyond COVID in our world, in the healthcare district. See the pun on the horizon, you get it, the helicopter? Right? I actually helped design this helicopter. That's the paint scheme that I helped. So I helped design. So we have 2 helicopters on order. We should be getting them in the summer of 2022, and that's to replace the existing Sikorskis. These are Leonardo 169s out of Italy. They are currently in Philadelphia. They are airworthy. However, they have not gotten their EMS outfitting in the back. So that's what's taking so long, plus they need to have FAA approval. We just recently got a COPCN, a Certificate of Public Convenience and Need, from the county to develop our own ground transportation unit. That is a limited license that's in response to some problems that we've had getting patients out of Lakeside. It's a long drive. When the East Coast was busy, we had a big struggle. We couldn't get our patients back to the East Coast in a transportation unit because they were busy. But we're going to solve that problem. In the middle of COVID, we put in a massive electronic health record. It's the first virtual, IT implementation of that size that I think Epic has ever done. But we went live July 1st. It has been very successful. Still refinement that needs to be done, but very successful, and we're heading towards phase 2. We're moving our clinics, so 3 of our clinics are going to expand and move. Right now, 4 of them are co-located inside the health department. We are squeezed for space. It's very institutional looking. So we're going to move a couple of those. We got federal grant dollars to respond to infrastructure needs as a result of COVID. So we're going to take them up on that offer, and we're going to move 3 of those. The MAT program, which is in the actual office, is inside of one of the buildings on the JFK North Campus. We have doubled in volume there, and so we're actually expanding and moving at the same time. It's been a very, very important growth project for us. And then behavioral health network. So we continue to expand our footprint. Somewhere along the way, years before I got here, they chose to cut the head off the rest of the body. So healthcare district was only responsible for physical health, not any mental health. We put the head back on the body, I like to say. So we put the head back on the body because it's often the same person that has the same needs. And, there's many examples of some of our patients coming in and they are, they have stomach pain and they have, issues that they think are physical that turn out, well, it's really just anxiety or it's, some other need. But we're putting the head back on the body. And we have a licensed clinical social worker in all of our locations. We have 2 psychiatrists. One of them is addiction trained, and that will be part of our expansion. And we're working with the county to see how big and how broad our footprint needs to be for this coming year. So in terms of changes as a result of COVID, I know that was one of the questions that was posed of me. I can't see into a crystal ball, but I can tell you what I've seen and what I hear, and I think what you guys already know. But digital behaviors will stay with us. The remote work concept, whether we wanted to do it or not, it's here. We're going to lose staff if we don't, get more flexible with that. Telehealth, we did a lot of telehealth during COVID. It works sometimes, but it doesn't work forever. At some point, you physically have to see a patient. You have to take that temperature. You have to do those vitals. But I do think there was more acceptance of telehealth than there ever would have been, perhaps, without COVID. And delivery services, I get an Amazon package every day. It's like Christmas, and I order dinner once or twice a week from delivery dudes. They love me, but I think some of those things are here to stay. The labor market. I can tell you from a healthcare perspective, it is crazy right now. I'm sure those of you that employ nurses or clinical people, it's wild. In order to maintain our staff, we're having every 4th day, we're having to give them a $1,000 bonus to take an extra shift. That's what the market is bearing. So hospitals, a nurse, for example, has a 12-hour shift. They do 3 12-hour shifts. Well, we need them another day. They're paying a $1,000 bonus plus overtime. This is not sustainable for us, for any of the hospitals, but right now we have to because they're leaving us, they're leaving the market. They are retiring if they can. They're going to travel agencies and getting premiums and sign-on bonuses. So I think it's going to take time to recover, but I think when we're done, it's still going to look different because the expectations are different. A lot of people, I think everybody realized in the middle of COVID, there were certain things we wanted. Financial security, we wanted to travel, and we like that social nature. But the folks that will never have the opportunity to work remotely, they want something different. And I think our nurses have borne the brunt of that. Supply chain, we already are seeing it. Everybody sees it. You can't get furniture for months. But other things, I think we're seeing that global supply chain and perhaps is going to scale back and be less global. And when they do adapt, more robots, more artificial intelligence, because you can't count on the labor force because they're all leaving the market or going for, where the grass is greener. And I think there will be a lot of different beliefs about public health. Public health over the years has been dismantled, dismissed because, when it's working, who's thinking about that, who's investing in it? But I think virus screening will stay with us. This is not gone. If you're going to travel, you're still going to have to show something. Politics aside, you're going to have to show something. I think masks, people are going to be, we love them, we hate them, but, somebody's going to put it on. I can't tell you how freaked out I am when I walk into a grocery store or somewhere and somebody starts coughing. I'm like, oh my God, put your mask on. It could just be the flu, but put your mask on. We're all now thinking that way. And I do think over time, call it a mandate or not, it's going to be like, measles, polio, all the other vaccines that were mandated. You have a choice, but I think ultimately that rule is going to spread, and I think that's where we'll end up. So I was also asked to talk about leadership. This is Leadership Business Council, so I thought I'd give you a little sense of me for just a moment. And I can tell you I never wanted to be the CEO. That was not my dream. I didn't go, oh God, what's that path? I have a lot of young people that come to me and ask me, how did you get here? I'm like, God, I don't know. No, I do know, actually. I came up on the healthcare finance track. I am a CPA. I just thought that the pinnacle of my experience was to be the CFO. Well, I did that when I was 40 years old. Well, no, I was 38. I was 38 years old in Savannah. And I'm like, yeah, it's all right. It's okay. I mean, it's not everything I thought it was going to be. But I was an extrovert in a field of introverts. So I was an interpreter, I was a translator, and I think that helped me connect with CEOs, it helped me connect with board members, it helped me to kind of rise up from what they might typically just say is, oh, that's just the financial person over there. I had a lot of terrible bosses along the way, and I would say I learned more from them than I learned from the good bosses. You learn what not to do. Right? And I think I think the most important thing about that is what I learned. Forget all their bad habits and the things that I didn't like. I learned to be more self-aware. So being self-aware helped me read the room. It helped me know when I was misstepping or doing something right. But also, when you're engaging with someone or not. And then, frankly, I was doing the work. I was the one, the go-to. So I said, you know what, I'm doing the work. I might as well step up. And I had some really good peers and coworkers who came to me and said, please be the CEO. Well, we don't know what we're going to get. Please. So I took a risk and I put my hat in the ring, and here I am. And I never look back, and I'm so happy that I'm here. But it was an interesting journey. My style, very approachable. You might call it casual, but I will tell you it is amazing what you hear from your staff when you listen to them. I cannot always remember their names. There's 1,400 employees. I can't remember their names, but I try to engage with them on something, even in the elevator. Make a comment on, oh, I love that purse. That's really cool. And, then it starts a conversation. I do these series of videos, and it started during COVID. I do these series of videos to our employees so that all employees were on the same page about what's going on. And I was filming those from my house. And I have 5 cats. And so I was sitting there, and a cat would run behind me, or people would be watching it trying to figure out what is going on. There's 2 cats fighting. So I became the cat lady at some point, but it is amazing how many people have come up to me and said, "Oh my God, I love your cats. Can you do more cat?" So then we started deliberately trying to put the cats in there. But being approachable, I have learned so many things. I have learned things that I didn't want to know, but I have also learned things that I needed to know that might not otherwise have filtered up to me if not having been approachable. I think I'm fair. My dad was a federal judge. I spent every night, in dinner table, debating, trying to come to conclusions. But my takeaway was focus on the issue, not the personality. You often, it's the same person again. Oh my God, here we go again. But sometimes, if you put the personalities out of the way, the issue is really how to get to the common ground. And then I'm decisive. I will always make a decision. May not be right. I can always undo it. We can try again, but at least we're moving. We're not paralyzed. So I will always come out of somewhere recapping the decision and making sure that we know that we're moving forward. And what do? Well, this is the textbook description. We set strategy. I'm the liaison with the board. Take guidance from them. I try to prioritize resources, manage to the budget, and then also represent the organization externally. But what do I really do? I sign a lot of documents. I mediate when my executive team is fighting with each other and pulling on resources. I think I'm a good troubleshooter. I like to come up with creative solutions. I credit that back to my dad and those dinner table conversations where you just wanted it to end. So you find a solution that's in the middle. And then I get a lot of outside inquiries, and occasionally we have a patient that will complain to the county commission who I'm like, who comes back to us and says, please take them. But I think most of my day is troubleshooting and responding. But that's it. That's the healthcare district in a nutshell.
Great, so let's open it up for questions.